I am Samantha Jane Ross from BSN 3C and I am going to perform colostomy care. This procedure allows us nurses to assess and care for the peristomal skin as well as to obtain stool for the analysis and to promote client comfort and prevent odor. So of course, first we need to assess for the type of the ostomy and its placement onto the abdomen, which is onto the sigmoid part. And we need to determine the type of the appliance used as well as the special skin barrier. Of course, we need to review onto the patient's medical record for the color, the size, the shape of the stoma, and of course the bleeding tendencies and the healing status of the client. We must prepare the equipments to be used later so to save time and effort. And of course, we need to identify the patient by two identifiers, the asking the patient itself and of course checking the name tag um, for the name and date of birth. So, good morning, Miss Drowsy. I am Nurse Samantha, your nurse for today, and I'm going to perform colostomy care. This procedure will help you to be at ease and to promote self-esteem, and of course, for me to assess your peristomal skin. So, the, explaining the procedure to the patient will help her to be at ease as well as to determine if she can cooperate. So, there. So, of course, we need to um, provide for client privacy by closing the doors and curtain, as well as if the patient is ambulatory, we may now assist her to the bathroom for uh, easy succession of the procedure. Then, of course, while doing so, we must now wash our hands and don our clean gloves. So now, after we have already done our clean gloves, we must now help the patient assume the position of comfort, which is for her is side lying, but other positions are also permitted, such as the side lying and standing position, if the depending on the mobility status of the patient. Then, of course, we must, after doing so, we must unfasten the seat belt or unfasten the belt if the client is wearing any there, and we must now provide a drape onto the client to prevent soiling the linen there, then there. So now we will remove for the old colostomy bag. Remove for old colostomy bag. There. Remove for the old colostomy bag and wipe off the fecal residue onto the stoma, as well as assessing the peristomal skin for its shape, the color, the appearance. If there are any abnormal signs such as abnormal redness there. Then, of course, after removing the fecal residue, we must now place a tissue, a gauze pad, or a washcloth onto the client's stoma to prevent being exposed and to prevent contamination. Now, for easy succession of the procedure, we must prepare for the equipments needed, of course, by using the size guide, which will be to determine the size of the stoma for the new colostomy pouch. So for the size, it is here, which is the 45 millimeter. There. Trace it onto the bag colostomy pouch using a pen, like so, and cut it using a colostomal scissors, making sure that there are no sharp edges to prevent skin irritation onto the stoma as well as onto the skin. Now, after doing so, set it aside, and now using a clean washcloth soaked in mild soap, we will cleanse the peristomal skin as well as the surrounding areas. Then, rinse it using a soaked in warm washcloth to relieve the client and to prevent tension onto the um, area there. Then, after, before placing the pouch onto the client's skin, we must not forget to allow the area to dry perfectly, and or if not, of course, we must use a washcloth and blot it dry. There. If the blood appears onto the stoma while rinsing it, it is normal, but if there are any abnormal bleeding, we must refer it onto the appropriate healthcare provider. There. Then, of course, we must now um, assess if the skin is absolutely dry, and now we must have the colostomy pouch placed onto the client's skin there, and hold it in place. Allow the client to hold it in place for about 1 to 3 minutes, and apply hypoallergenic tape onto the sides to prevent the pouch from moving there. There. Then, of course, we must not forget to fold the bottom of the pouch and clamp it using the colostomy bag clamp. Then, after that, of course, we must not forget to dispose all the appliance in the appropriate trash bin. The soiled um, drape onto the appropriate trash bin there, and of course, removing the gloves onto the appropriate trash bin. Now, we must not forget to evaluate the appearance of the stoma around the skin, the incision, and of course the when the pouch is removed, of course, the appearance, the color, the size, the shape, the abnormal findings, the bleeding tendencies there, and if there are any abnormal deviation, we must not forget to report it to the appropriate healthcare provider, as well as to document onto the patient's onto the nurse's notes the We must not forget to document up to the nurse's notes the type of the pouch, the skin barrier used, and of course we must not forget to document the amount, the appearance of the pouch, the size of the stoma, the color, the texture, the condition, and of course the peristomal skin as well as the sutures. So this procedure is what we call the colostomy care. Thank you.